What is constipation? Let us explore the common digestive issue of constipation, its causes, symptoms, and strategies for prevention and management. This presentation aims to demystify constipation, empowering you with knowledge to maintain optimal digestive health. Defining constipation based on 1. Frequency and difficulty of passing stool. Constipation is generally defined as having fewer than 3 bowel movements per week, or experiencing significant difficulty passing stool when you do. 2. Widespread impact health issue. It's a prevalent issue, affecting approximately 16% of adults in the U.S., with that number rising to an estimated 33% among older adults, highlighting its commonality across age groups. 3. Individual variation. It's crucial to remember that normal bowel habits vary significantly from person to person. What's normal for one individual might range from 3 times a day to 3 times a week. How constipation happens. The science behind it. Constipation occurs when waste moves too slowly through the large intestine, also known as the colon. This delayed transit allows the colon to absorb an excessive amount of water from the stool, causing it to become hard, dry, and difficult to pass. The primary reason for this slowdown is often insufficient or uncoordinated muscle contractions within the colon. These contractions, known as peristalsis, are essential for propelling waste along the digestive tract. When they are sluggish or irregular, stool lingers, leading to the characteristic symptoms of constipation. Common symptoms of constipation: 1. Hard stools that are difficult to pass, often described as hard, dry, or lumpy in consistency. 2. Straining, requiring excessive effort or experiencing pain during bowel movements. 3. Incomplete evacuation, feeling as though you haven't fully emptied your bowels, or a sensation of blockage in the rectum. 4. Infrequent movements, having less than 3 bowel movements within a week, which is below the general threshold for regularity. Lifestyle causes, what you can control. Many factors contributing to constipation are directly related to our daily habits. By understanding and modifying these, you can often significantly improve your digestive regularity. 1. Low fiber intake. A diet lacking sufficient fiber from fruits, vegetables, and whole grains is a leading cause. Fiber adds bulk to stool, making it easier to pass. 2. Insufficient fluids. Not drinking enough water dehydrates the body, including the stool, making it hard and dry. Aim for consistent hydration throughout the day. 3. Lack of exercise. Regular physical activity stimulates the natural contractions of intestinal muscles, helping to move stool through the colon more efficiently. 4. Ignoring urges. Suppressing the urge to have a bowel movement can train your body to ignore these signals, leading to harder stool over time. Routine changes. Travel, changes in diet, or increased stress can disrupt your body's natural rhythms, temporarily affecting bowel regularity. Medications and medical conditions that cause constipation. 1. Medication side effects. From medications prescribed by your doctors are opioid painkillers, antidepressants, certain blood pressure medications such as calcium channel blockers, some allergy medications, antihistamines. 2. Underlying medical issues already pre-existed in your body are hypothyroidism, diabetes, irritable bowel syndrome, IBS, neurological disorders such as Parkinson's disease, multiple sclerosis, pelvic floor dysfunction, which is the impaired muscle coordination during bowel movements. Who is most at risk? While anyone can experience constipation, certain demographics and health profiles face a higher predisposition due to physiological, hormonal, or lifestyle factors. 1. Women, especially during pregnancy, due to hormonal changes and pressure on the intestines, and after childbirth due to muscle strain or fear of pain. 2. Older adults, slower metabolism, decreased physical activity, certain medications, and reduced muscle tone in the digestive tract contribute to higher risk. 3. Dietary habits. Individuals with diets consistently low in fiber miss out on essential bulk needed for healthy stool formation and easy passage. 4. Medication users. Those regularly taking drugs known to induce constipation, such as opioids, iron supplements, or certain antidepressants, are at elevated risk. When to see a doctor? While often manageable at home, certain symptoms or persistent issues warrant medical attention to rule out underlying conditions or receive appropriate treatment. 1. Prolonged symptoms. If constipation lasts longer than 3 weeks, despite lifestyle adjustments, it's time to consult a healthcare professional. 2. The concerning signs. Any presence of blood in your stool or rectal bleeding should prompt immediate medical evaluation. 3. New onset. If you experience sudden, severe abdominal pain or unexplained weight loss accompanying constipation, seek urgent medical advice. 4. Ineffective changes. When self-management strategies like increasing fiber and fluids fail to alleviate symptoms, professional guidance is necessary. Managing and preventing constipation. 1. Increase dietary fiber. Gradually incorporate more fiber-rich foods into your diet, aiming for 25 to 30 grams daily from fruits, vegetables, legumes, and whole grains. 2. Stay hydrated. Drink plenty of water throughout the day, targeting at least 8 cups, 2 liters, or more to keep stool soft and easy to pass. 3. Be physically active. Engage in regular exercise, such as walking, jogging, or yoga, to stimulate bowel muscle contractions and improve regularity. 4. Don't delay. Respond promptly to the urge to have a bowel movement. Ignoring these signals can lead to harder stool and make passing more difficult. 5. Laxative caution. Use over-the-counter laxatives sparingly and only under the guidance of a medical professional, as overuse can lead to dependence. Summary. Taking control of your digestive health. 1. Constipation is a common but manageable problem. Constipation is a widespread issue, but it is often effectively managed through simple and consistent lifestyle adjustments. 2. Understand causes of constipation. Identifying and addressing the underlying causes, be they dietary, lifestyle, or medication-related, is key to preventing chronic issues. 3. Healthy habits, better health lifestyle. Embracing healthy habits today, including adequate fiber, hydration, and exercise, which lays the foundation for improved digestive health tomorrow. Seek medical advice. Don't hesitate to consult a doctor if symptoms persist beyond a few weeks, worsen, or are accompanied by concerning signs like bleeding or unexplained weight loss. Bristol Tool Chart. This chart, called the Bristol Stool Chart, is a way of identifying constipation. Constipation generally refers to poo that is type 1 or type 2 on the chart. The poo is often hard and difficult to pass. Forceful straining can lead to various complications like hemorrhoids, anal fissures, and even rectal prolapse.
Here's the color-coded chart showing laxative types and their approximate onset times, from fastest, green, to slowest, yellow/red.
Laxatives review. 1. Oral osmotic laxatives. Examples: Phillips milk of magnesia, magnesium hydroxide, Miralax, polyethylene glycol, Movicol, Macrogol plus electrolytes, Dufalac, lactulose. How it works. Draw water into the bowel from surrounding tissue to soften stool and make passage easier. Onset time. Milk of magnesia, approximate 6 hours. Movicol, 1 to 2 days. Side effects is it can cause diarrhea. 2. Oral bulk-forming laxatives. Examples: Benefiber, Citracel, Fibercon, Metamucil, psyllium husk or other fiber. How it works. Absorb water to form soft, bulky stool, prompting normal intestinal muscle contractions. Onset time approximate 2 days. Side effects is it can worsen constipation if not taken with enough water. 3. Oral stool softeners. Examples: Colace, docusate sodium, Surfec, docusate calcium. How it works. Add moisture to stool to make bowel movements strain-free. Onset time varies, generally mild onset. Side effects is possible electrolyte imbalance if used long-term. 4. Oral stimulant laxatives. Examples: Dulcolax, Bisacodyl, Senecot/Sena, Senicides. How it works. Stimulate rhythmic contractions of intestinal muscles to push stool out. Onset time. Within hours. Side effects is it can cause cramping and diarrhea. 5. Stool lubricants/rectal suppositories or enemas. Examples: glycerin suppository, docusate suppository to be inserted rectally, it lubricates and softens stool directly. Onset time approximate 5 to 30 minutes. Side effects. Docusate suppositories are for short-term use, less than 5 days, and don't cause dependency.